Abdominoplasty or tummy tuck is a procedure that's mainly geared to making the stomach flat. What you're doing with the abdominoplasty is you are dealing with extra skin on the abdomen and also loose muscles, loose fascia. So the person that needs abdominoplasty is a person who has a lot of redundant skin on the abdomen, a person whose muscles are very weak, allowing the stomach to be very protuberant, needs abdominoplasty. That's a person where liposuction may or may not work. What you're physically doing with a tummy tuck is making an incision low down in the pelvis, raising a skin pannis from the pelvis all the way up to the xiphoid, all the way up to the ribs, leaving the bottom half of the belly button in place. What you're doing from there is then tightening the muscles. You're imbricating the muscles. So you're using plication sutures to imbricate the muscles. This imbrication is really the thing that makes the abdominal wall flat. And that's really what the liposuction is doing. Then from there, you're putting the skin on stretch. You're taking the top half of the skin and you're pretty much stretching it to cover the whole abdomen. Removing most of the time, you're removing the skin from the navel to the pelvis and stretching the top half down. That's physically what you're doing when you do the abdominoplasty. A person that needs abdominoplasty is a person where the abdominal muscles again are stretched apart and where there's a lot of redundant skin. Now, the recovery from abdominoplasty is a little bit hard. It's kind of what I also say is about 50% of C-section pain. The first 2 days, most patients don't want to move, and their pain is very severe. Third day, they start to feel a little bit better. 1 week, the patients are walking slow, they're guarded, bent over, don't want to shake, don't want to move. Most people by 2 weeks have a normal gait. Most people need at least 2 to 3 weeks off after abdominoplasty in order to get back to everyday activities. So far as heavy activities, strenuous activities, it would be 4 to 6 weeks before doing heavy lifting and pulling. The things you have to consider for the abdominoplasty, the complications you must consider are complications of wound healing, problems with wound healing, keloid formation, infection, hemorrhage. Hemorrhage is bleeding. You might see a hematoma under the skin, wound separation, and those are the things, other than the complications of anesthesia, those are the complications, things you must consider with abdominoplasty. People will improve for really up to 3 to 4 months after abdominoplasty with the wounds, and the wounds will even improve up to 1 year. But people will have swelling resolve 2 to 3 months will kind of be the idea when you're finally getting the look of your results after abdominoplasty. The abdominoplasty is a procedure that should be done after you've finished with your childbearing years, because with a tightening of the muscle, it may have problems with pregnancy and things after abdominoplasty. So this is a procedure that should be done when your childbearing time is finished. The abdominoplasty's main goal is to make the front of the stomach flat. Sometimes liposuction is done with the abdominoplasty in the waist to help make the waist narrow. But the abdominoplasty's function is really to make the stomach flat. Thank you.